Good morning, friends. This is Dr. Murugesh. In this episode, I am going to tell all the benefits of walking. So far, we have learned what are the pre-walking evaluations to be done, what is the best walking technique, etc., etc. But what is most important is what are the overall health benefits of walking. Walking improves the muscle mass, skeletal muscle mass. As you walk, as you all know, walking is a low impact aerobic activity. It is also a weight bearing activity, helps in improving the knee muscle mass. It increases the number of muscle fibers, it increases the muscle size, and more muscular the person becomes, as I said, more is the basal metabolic rate, which can exert a better control over his blood sugar level, metabolism. Next, walking improves the strength of the bone. It increases the osteoblastic activity more than the osteoclastic activity. It helps in mineralization of the bone, more deposition of calcium phosphate, collagen, magnesium, etc. So the person who indulges in walking over a period of time has an improved bone mineral density, because this bone mineral density is very, very important, especially in postmenopausal women. Once their protective effect of estrogen is gone, their bone mineral density drastically falls down, making them prone for osteoporosis. And the osteoporotic bones get easily fractured for even with a little stress, which is a common problem faced by all the elders at home. So advise them walking habits earlier. When they indulge in good walking habits in their younger age, prevents them from skeletal muscular injury and disability thereof in elderly. So a good walking program protects or gives the quality of life when you are old, which is very, very important, because all elderly people are very concerned about the quality of life, whether they are able to move around, they are able to fulfill their basic requirements, whether they are able to socially connect. That is what they want ultimately. So for that, to improve an improved skeletal muscular strength is very, very vital, and walking helps in improving skeletal muscular strength. Next, walking improves circulation. Walking decreases the stickiness of blood. When blood circulates, it carries all the vital nutrients to all the cells, especially the gas exchange process is proper, so cellular health, the health of the endothelium is maintained, circulation is good. Walking is helpful to maintain exactly that. Then walking in blood decreases the unwanted things. Say for example, decreases the blood sugar level, decreases the blood cholesterol level, and improves the protective effects. Say increases the HDL level and increases the leptin level. When you walk, the only hormone that increases the cell membrane permeability to glucose is insulin. Only in the presence of insulin, glucose can enter the cell. It undergoes a process called glycolysis. It's converted to ATP and used as energy. In a diabetic, when there is a lack of insulin, the glucose which is available in circulation is not able to enter into the cell, and it's not able to be utilized. So that is the first problem for a diabetic. So a diabetic remains hyperglycemic, and it is this increased blood sugar level that is harmful to all the cells in a diabetic. The only capacity other than insulin to increase the cell membrane permeability for glucose is exercise. Exercise is the only other alternative to insulin. Exercise can improve the cell membrane permeability to glucose. When a person walks, the cell becomes more permeable to glucose. Glucose can enter into the cell, and again glycolysis can take place. Thus, it helps to reduce the blood sugar level. Thus, it is also helpful in conserving the vital hormone insulin. Pancreas is like a bank where this currency of insulin is stored. We should learn to conserve this currency of insulin as much as possible. So the first and foremost advice we physicians give to all diabetics is lifestyle modification. Walk. As you walk, the cell membrane becomes more permeable to glucose. Glucose enters into the cell, which helps in decreased insulin load, beta cell degeneration, further beta cell degeneration. The requirement of drugs is less. A person who is insulin dependent, the insulin requirement is less, and there is even a chance for diabetic reversal. I have seen so many of my patients with the proper walking technique, having the blood sugar under control and their dietary pattern, regulate the blood sugar level without any medication, whether it is drugs or insulin. So walking is helpful to decrease blood sugar level. I underline. It is also helpful to decrease the cholesterol level and the low density lipoprotein level. And walking is the only way by which we can improve the good cholesterol, that is HDL. There are no drugs or no proven natural supplements to improve HDL. Walking is the only way to improve HDL level also, which is supposed to be cardioprotective. And walking improves leptin level, and this leptin suppresses hunger, prevents us from overindulging. It is a hormone that acts at the hypothalamic level to suppress hunger, so that we don't overeat, don't increase the energy intake. Right? Then walking improves, as I said, good hormone levels. These good hormone levels like dopamine, enkephalins, endorphins in the brain improves the mood of the person. The person's confidence to face difficult situations. It decreases the anxiety in the person. It helps the person to combat the stressful situations. So walking improves the good hormone levels. Then walking increases the cardiorespiratory endurance of the person. The cardiac chambers themselves enlarge, the heart gets hypertrophied, so the stroke volume increases and the heart rate decreases. A regular walker, the heart rate will be only 60 per minute, whereas normally it is between 70 to 80 per minute. So a heart can pump lesser and pumps more to supply the required cardiac output. So walking helps to improve the strength of the heart. Also, walking improves the respiratory endurance in the sense the minute volume, the tidal volume, the amount of air he takes from the atmosphere every minute or every breath improves due to walking. Lung, there are 3 zones, upper, middle and lower zone. We seldom use all 3 zones, but when you are regularly walking or a regular person in exercise, all 3 zones of lungs are utilized. So maximum utilization of the lung parenchyma, which will improve the respiratory endurance also. So walking improves cardiorespiratory endurance. Next, walking decreases the blood pressure. A chronic walker, a person who exercises over a long time, has an improved skeletal muscle blood supply. The vessels dilate due to the local metabolic factors. So an improved blood supply means reduced resistance in the peripheral level, and a reduced peripheral resistance, add on to that an improved cardiac efficiency, all causes a decrease in blood pressure, say to an extent of 4 to 7 millimeters of mercury. So walking helps in managing blood pressure also. Then walking, as I said, is helpful in conserving the vital hormone insulin. Once insulin, the vital hormone, is conserved, it is helpful to preserve the beta cell. It is the beta cell degeneration that is the cause for diabetes. A person, if he is becoming a diabetic now, his beta cell degeneration would have started at least 15 years ago. Once almost 60% of beta cells will be degenerated before he becomes an established diabetic. A regular walker, by conserving the insulin, by decreasing the beta cell load, his onset of diabetes, even if he is genetically prone, can be postponed. Then walking is helpful, very, very helpful in treatment of malignancy also. It releases or it decreases the release of C-reactive protein, amyloid A protein. All these inflammatory markers level are reduced in a regular walker, and thus it is helpful as an add-on measure in the treatment of malignancy. Early stages, especially there is great improvement because of these reduced biomarkers, which are an important benefit of walking. Thank you.